We're going to go ahead and do denture care. Let's get started. First thing we're going to do is wash our hands, and we're going to assemble our equipment. The first equipment we're going to talk about is the protector, clothing protector. It can be plastic or it can be a towel. It needs to be the big towel, not the washcloth. We're going to also talk about the container. This is the lid with the client's name and room number on the lid, as well as the denture, upper and lower denture, and the denture container. Also, we have denture solution. We have the denture care toothpaste. We have the denture brush, the pointy part, and we have the bigger, smoother part, and we have the emesis basin. So let's go ahead into the client's room and introduce ourselves. Knock, knock. Good morning, Ms. Brown. My name is Yvonne Durant. I'm going to be your nursing assistant today. What is your name? Mary Brown. Let me take a look at your ID. Good. What is your date of birth? Wonderful. What we're going to do is I'm going to take out your dentures, and I'm going to clean those, and then I'm going to go ahead and do oral care, and then I'm going to go ahead and feed you. Would that be okay? Okay, great. Let me go ahead and lock the bed. I'm going to provide privacy, and I'm going to elevate my client, get my client ready for oral care. Even though we're doing denture, I'm going to go ahead and perform putting the client into that 90-degree angle and get them ready for oral care once I'm finished with the denture care. It's always good to raise the bed until the bed gets to 90 degrees. You'll know that because the bed will stop. Will not be able to go any further. Great. And I'm going to go ahead and put on the client's clothing protector. I'm going to use the towel instead of the plastic container, but you can use any one. And I'm going to go ahead and put on my gloves. Ms. Brown, I'll be right back. I'm going to go ahead and take out your dentures, and then I'm going to wash them, and they're going to bring them back. Let's go ahead and take out her dentures. Usually go in and pull the top portion of her dentures. Then I go to the bottom and pull the bottom portion of her dentures. Great, I have your dentures. I'm going to go and take these dentures, and I'm going to clean them with the solution, my dentures, and my equipment. Let's go ahead and clean those dentures. Before I lay down my equipment, I want to make sure that I place the barrier so I can lay down all my equipment. Before I do that, I'm going to go ahead and line the bottom of the sink to prevent the dentures from falling into the sink. I'm going to go ahead and turn on the water so the dentures fall. The dentures are not going to be broken because there's water lining the sink already. First thing I'm going to do, I'm going to take these dentures and I'm going to put them into the emesis basin, and I'm going to rinse out my container, and I'm going to rinse out the lid. I'm going to lay that down. I'm going to go ahead and add solution and get ready for my clean dentures. I'm going to go ahead and I'm going to take the brush. I'm going to moisten that. I'm going to put some denture paste on each side. And then I'm going to pick up each individual dentures. I'm going to moisten it first with water, and I'm going to start to clean. You can always start at the top. This is the top denture. Circular motion. Then go down. Get all those food out of the client's denture. We're going to go to the bottom. We're going to do the same thing. Get all that food. Go in a circular motion. We want to go to the top part of the gum. Get all that food. And then we're going to use the very pointy part of the denture to get all the food from underneath those grooves. And this portion where the tongue will sit, I want to go ahead and wash that out. Then I'm going to carefully hold those dentures, make sure they do not fall in the sink, rinse them off in warm water, and I'm going to put that into the clean denture cup. I'm going to do the same thing for the bottom dentures. I'm going to do the same thing, circular motions. Go down, clean those bacteria, food out of the client's denture. Going to go underneath the bottom, circular motion. Going to also go inside the grooves. Make sure you hold those dentures. They can be very slippery, and we do not want them to fall. And then we're going to go ahead and rinse. And I'm going to place that denture into the client's clean container. I'm going to cover that denture. I'm going to go ahead and clean out this denture brush. And I'm going to also clean out the emesis basin. And I'm going to place my denture brush. I'm going to take that protector, must be removed out of the sink. Dispose of that with my glove. I'm going to wash my hands. I'm going to turn off the sink. Turn off the pipe. And I'm going to go ahead and put on clean gloves. And I'm going to bring these dentures back into the client's room. Discard of my barrier, and then I'm going to place these in this client's room. Ms. Brown, do you want me to go ahead and put your dentures in now? Are you ready to go ahead and eat? No? Okay, let's go ahead and do oral care first, and then we're going to go ahead and give Ms. Brown her food. Thank you.